Hey guys, Dr. Eric Smith at Optimal Health Chiropractic in downtown Chicago. Today I have the amazing Chris Hester, Raging Silverback on IG if you find him. He is one of our bodybuilders here that he's been getting around the United States, but he's kind of locally right now in Chicago, right? So he's a sponsored athlete by a couple good big companies that you may know. Check out his Instagram, you'll see them there. I highly suggest if you're interested in bodybuilding or any of that sports world, he's a guy to follow because you're competing for your next show.
At the USA's in July, July 24th and 25th out in Las Vegas, going for that pro card.
Awesome, awesome, yeah, because you did your last show, you were up first place, I believe,
Yeah,
right?
first place, first in my class and second overall.
Yeah, that's awesome. That's very good. And that was his very first show. So Chris is coming to me today because one thing that we treat in this office is lower back pain. And so obviously he's got a lot of muscle mass and some of the things he's been doing to develop his body. He's been having a lot of stress in his lower back. So today I'm going to demonstrate what we do in terms of treating lower back pain, but as well as show you what spinal decompression can do. So what we're going to do, obviously, with the adjustment is to work on his neurological system, getting everything in the brain to be able to talk to the body to be able to talk to his brain real well, because right now he still needs to continue to grow and get ready for his competition. Now, also, with that being said, we want to get the function of his discs and how his lower back works working better as well, not only for short-term help in terms of decreasing pain, but also keeping those discs nice and healthy, because clearly the man has a lot of muscle on him. So that compression that you have on the lower part of the back can be problematic in the short term or in the long term, and we want this guy to be as happy and healthy as long as possible, as well as being able to lift as long as he wants to. So I've already done his examination, kind of checked out what's going on, but Chris, could you kind of explain like what you feel when you're lifting or what you have problems with?
So like over the last month and a half, I've been dealing with lower back issues from rack pulls and conventional deadlifts. So my buddy Eric hit me up, wanted to get me checked out so we can get back to optimal health, because it's a big show coming up, so we need to be fully ready to go. So let the man get to work.
Absolutely. So if you don't mind, I'm going to have you come on over here. I'm just going to get this paper changed real quick. And have you go ahead and lay face down for me, please. Okay. So I've already done the examination on Chris like right before we got to this video, but I want to show you some of the things that I look at here. Kind of checking out his low back. He's got a lot of lower back tension from, well, he said, doing rack pulls and such. So when he has and leans back, he gets pressure, but also that pressure when the muscles start to tighten up tend to make it a little bit harder for him to move forward as he needs to. So what we're going to do is get him loosened up a little bit by using this table to stretch out his joints, get some more natural movement through his spine, and then we'll get into more of his adjustments. So Chris, I'm going to have you slide down the table just a little bit for me, please. Perfect, right there. Awesome. So this is just some natural movement. First we go front to back, and then we'll go side to side in a circle. This is helpful not only for the patients to kind of feel the areas that might be a little more involved, a little more tense, but it's also going to help in the areas there that are a little bit more tender and need kind of to get ready and prep for more of the direct spinal adjustment that I'm going to do. So that motion most people are pretty used to, but this is a motion that I usually find a lot of restrictions. So you can kind of feel that moving around in there, Chris. So usually the only people that get really good at that motion are ones doing like Zumba classes or some type of Latin dance. So I'm not sure if that's in your workout regimen, but I'm assuming it's not right after the rack pulls or deadlifts or anything like that. Cool, great. So some of the other things that we see with him too, has a pelvis that's a little bit more forward due to all the muscularity that he has back in his in his glutes through here and in his really well-developed erectors. But we're going to start with an easy adjustment. You're going to hear some pops and cracks when we do that. That's just gas being released from the joints. That is also the same gas that causes the nerve pain that most people feel, and also why when it's released, you tend to feel better when it's gone. So let's just start with some easy ones in the middle part of your back, Chris. This is his first adjustment, by the way, so this might be kind of interesting to see how he reacts. Go ahead, take a nice deep breath. All the way out. Good, and just relax as much as you can for me. Good. Awesome. Okay. We're going to have you just drop your arms to the side here. I'm going to take my hand right here. Just let this relax for me. Good. Ooh. Good. Go ahead and lay on your right side for me, please. I'm going to take your arms, pull you out a little bit here. We're going to drop this part of your leg off the table. I promise I'm not going to drop you. I haven't dropped anybody yet, and you're not going to be my first. So let this relax for me as much as you can. Good. Awesome. Go ahead and lay on the other side. I'm going to take this here. Nice little stretch through your hips. Good. Perfect. Just relax. Perfect, good. Woo, lots of movement out of there. Go ahead and lay on your back for me. So he told me he hasn't gotten any muscle work done recently, so notice a lot more tension. Even though he's complaining of mainly lower back pain, I still want to influence his nervous system, allow his brain to talk to his body the best by getting the rest of the spine adjusted. So even though he was just complaining of more back pain down there, in the diameter of the nerve, only about 10% of it's actually pain fibers. So I want to make sure his brain can do what it needs to do to keep this man growing, and then he's going to start dieting down here in about 5 weeks. Cool. Let this head relax for me. Awesome. Whew. Now I want to get the middle part of your back. I'm going to have you assist me with this because I'm going to use your body weight to help me out. I'm going to slide my hand right behind your back. Give you a nice little hug. Good. Awesome. Okay, you can stay right there. One thing I want to do is take a look because you were having a little bit of low back pain. Kind of get into the hip here. Kind of open this up. Let this relax for me. Awesome. Okay, let me help you up here. Go ahead and swing your legs over to that side. Lots of pops and cracks out of you today. If you don't mind, move your head around in a big circle there. How do you feel? A little bit looser? A lot looser. Okay, let's check out your low back now. So go ahead and stand up for me, please. Let's have you slowly bend over and touch your toes. Good. That was a lot quicker. Feel a little looser? Okay, go ahead and lean back for me. Any issues with that?
Nope.
Excellent. So now what we're going to do is we're going to go in the next room and we're going to do some spinal decompression. So let's show you how that looks. So what we're doing now is we're getting Chris all set up on spinal decompression. So what the machine does is uses a pulley here, and we'll be putting a belt on him, as well as getting him all set and strapped in here. So what spinal decompression does is it pulls off weight off the lower part of the back by slowly decompressing the spine up to a maximum amount, and then we have it go back and forth in terms of oscillating for a certain amount of time at a certain angle. And that's the difference between just normal traction and what spinal decompression is. So we're getting him all set up here. Pretty simple setup. And you see it's pretty comfortable. So if spinal decompression is something that you think you need, if you have any pinched nerves or other issues going on in your lower back, feel free to contact us at the office. I can answer any questions and see if spinal decompression is for you. We'll check in with Chris later to see how he's doing. Thanks for watching.